Well, this is Jason Renault again with the Alternative Mobile Services Association, and today I'm speaking with Justin Nutt of the Nurstead Counseling Services in Clovis, New Mexico. Hello, Justin.
Hi.
Thanks for coming and talking with us. And Justin, your organization runs the mobile crisis team for the Clovis area.
Yes,
That's
sir.
really interesting. Can you tell us a little bit about how that got started?
I was the COO of the Community Mental Health Center here. I actually moved from El Paso to Clovis to take that position. And there was a point they were talking about CCBHCs,
Mhm.
Certified Community Behavioral Health. And one of the requirements in New Mexico is mobile crisis, either directly part of it or as what's called a DCO, so a designated collaborating organization. And I very much want to do crisis. I've done a lot of crisis response, mass shootings, and officer involved shooting, those kind of things. And so I thought it was really important, especially given kind of what goes on in our area from a mental health and crime and drug abuse standpoint. But the CEO at the time was like, "Yeah, I don't really want us to do that. We would need to contract that to somebody." And my response was, well, can I be that somebody?
Hmm.
And he basically said, if you want to resign, and I think he thought that was the end of the conversation. And I more was like, well, I guess this is the beginning of the conversation. And so went through the process with the state to talk with them about the grant that they had for expanding mobile crisis. And then a few months later, I remember he was in another one of our offices, and I video chatted him, and I'm like, "Hey, you remember that conversation? So I'm resigning." And so that was about almost 2 years ago, I guess. That was my last day. It would have been April 28th of 20. And then May 1st started working really towards mobile crisis. And I think we were technically live by July 1st, July 7th.
And so July of
July
2023?
7th of 23. Yeah. So
Yeah,
about 2 months.
right at the end of COVID. And so you're not a conventional nonprofit executive director type. You are come from a therapy background.
Yes, sir. So I am a clinical social worker. So I have an undergrad and a master's in social work, multiple clinical degrees. And so was in private practice and then kind of moved to the executive side.
And you do some other training as well. You do training with police.
Yes, sir. So we have what four crisis intervention trainings ranging from 2 to 40 hours. We also work with corrections. We actually one of ours is our 4 hour like basic crisis intervention, suicide prevention, and looks at not just the crisis intervention piece, but also very much looks at that self care for first responders. That is actually a required course for every corrections and probation officer in the state.
Hmm,
We do a fair amount of training.
that's great to hear. That's great to hear. Tell us a little bit about Clovis, New Mexico. Not all of us are familiar.
So I wasn't familiar honestly before I took the job. I lived in Kansas when I was in private practice. Ended up moving to El Paso. What 7 8 years ago, and I didn't realize until I had lived here for like 3 or 4 years that when I was driving down, I skirted it. It's one of those towns that, as you go through, you either look at it like it's a small town or it's a big town, depending on the town you come from. It's about 40,000. The biggest thing is it's very isolated.
Hmm.
It's about 2 hours from Lubbock or 2 hours from Amarillo, 3 4 hours from Santa Fe and Albuquerque.
Hmm.
So it's not a small town, but it's very in the middle of nowhere to some extent. There's a lot of highways that run through it, but it's usually 2 hours to get anywhere.
So
So
you need to be pretty independent. You be pretty resourceful.
generally speaking, yes, simply because any additional resources of any higher level of care to speak of are going to be 2 to 4 hours away.
Hmm.
Like when somebody gets placed, they're ending up in a inpatient psychiatric hospital that is Albuquerque or Las Cruces. So you're talking Las Cruces is probably 5.5 hours away.
Mm, that's a long ride
That's definitely.
if you're just sick. Oh, so tell me about your team. It's a CC, it's not a CCBHC team.
No, sir. So we do have meetings with the community mental health center that I used to work for,
Hmm.
to be their designated collaborating organization, since we already have the established mobile crisis here. But um, we started, that was the only thing we did when we started. We were literally just a company that did mobile crisis, um, and then added in a number of different programs in the last 2 years. But our team is made up of, I'm trying to think, two um, clinical social workers. We have a licensed mental health counselor, and then 8 or 10 um, peer supports, or what's called community support workers, that make up that team. And depending on what the call is and the need of that situation or the follow up, that 2-person team is the one that would respond.
Well, that's great to hear you're able to employ peer workers.
Yeah. And I think it's hugely important. It's one of those that I think initially when the state was pushing it, they very much wanted it to be all clinicians.
Hmm.
And reality, I think there's a very, very key piece for somebody that's been through situations, somebody who has lived experience and has come out the other side. But I also think it's a way, especially when you look at rural areas, you're never going to be able to field a team of 6 or 8 independently licensed people so that you can have somebody during the day and somebody at night and do a rotation and really make it sustainable, because there's just not that many therapists.
Hmm.
And so it's one of those that I think that peers and community support workers are a hugely valuable asset, especially if they're well trained in what they're doing.
Well, that's very encouraging. So your team is operating what sort of hours and what's your time cycle?
So we operate 24 hours a day, 365 days a year. Um, from the clinician side, we take 2 weeks at a time. We're literally on for whatever that would be, 336 hours straight. We're on call.
Mm-hmm.
Um, and I say that, but I can say I think as CEO, I tend to take more of the day calls because I have meetings, but the other therapists have patients. And so they're working with people. And so I think that it really is more of a case of we're interchangeable. If one of us is busy, even if it's like, hey, I'm at dinner, we might call another one and have them go. But we operate, 24 hours a day, 7 days a week, and we cover what, close to 5,000 square miles.
And so so we can be clear, these are people who are they're not necessarily working, but they're on call during this long period of time and available to go. And if they're not directly available to go, there's another person you have in your telephone tree who can go.
Yes. So
Wow.
as far as like therapists, one of us is always primary on call and somebody's already secondary, just in case. And then we have a drop-in center that operates 24 hours a day. And so we have individuals who are legitimately working 24 hours a day in the drop-in center. And so if it's 2 a.m. and it's a situation where 2 peers or community support workers can take that, we may tell them, hey, is there anybody over there? If there's not, we might send them if it's a situation for them. Otherwise, I think I live about 5 or 6 minutes away from the drop-in center, and I'll literally start driving over there. I'm like, all right, man, I'm gonna be there in 5 minutes. Like, be ready to leave, and we'll pick them up and go to the call.
So this is the value of living in a small town. You have a 24-hour drop-in center price.
Yes, we have the only 24-hour drop-in center in the state.
Okay.
So
Well, that's a huge resource, especially since your hospital is so far off, some place to take people.
yeah, and we have law enforcement that like in most situations we're getting called out. In some situations, if it's out in the county or where they may not want to wait an hour and a half because realistically, from where I live to the southernmost point is probably over an hour and a half drive
Mm.
of our coverage area.
Yeah.
And so in that case, they may actually just bring the person to the drop-in center, and then the peers can work with them. A lot of times it's just emotional instability or more basic case management items maybe that they need, but we are always on call too, show up over there.
I imagine that in a city the size of Clovis, pretty much everyone knows everyone else. What's your relationship with the police?
So I'd say I have a pretty good relationship with law enforcement, fire, EMS here in Clovis. Being just the nature of it, I do not know all of the county people. We don't work a lot with the sheriff's department just because I think by and large it's one of those situations where it's what I think Clovis or Curry County, which is where Clovis is up 2,000 square miles, something like that, and it's 4,700 or 47,000 people, but Clovis is a little over 40,000. So most of our calls are obviously within those city limits, but we work really well with them. We have a relationship where they can call us up and they'll ask us questions, or if something happens, they'll stop by and give us a heads up. And then there's those times where they need to talk or we need to talk because of that kind of shared experience of a different level of crisis and trauma as a therapist, right? Like law enforcement sometimes is a better sounding board than another therapist. So I would say we have a pretty good relationship, luckily, with law enforcement.
Well, that's a level of intimacy that's really unusual and you're sounds like it's quite beneficial.
Oh, most definitely. The biggest piece I think is, a lot of mobile crisis teams and crisis lines, they put them through 988.
Mm.
So like one state location. And here, it's always been how it was, which is call 911.
Mm.
And so for our mobile crisis, we maybe had in 2 years, 10 or 12 that came from 988. But last year we had what I think there's an infographic that was put out, and on that it was 209 calls over the course of 13 months.
Mm-hmm. Mm-hmm.
And in a 2-year period, we had like 10 or 12 from 988. So that close connection and relationship with law enforcement and having a unified dispatch center, they can literally just call us, our on-call phone. We answer, they give us the information, they tell us where we are or where they are. When we show up, another benefit is because it's a small enough police force, when we show up, they generally know we're not some random person stopping and that we're a threat. They're generally like, thank you. Now we can go back to being law enforcement instead of being a therapist.
So yeah, the right person for the job.
Definitely. I think that's the key piece to me of a non-co-responder model, which is very much what New Mexico wants, is law enforcement not that they can't be a referral source, or there's not situations where it's dangerous and we have to call law enforcement in, but one where we're not constantly showing up for law enforcement. So it's a person to person, right? Like a peer or a therapist going out there and just talking as normal people. And that situation allows a lot of times we show up on scene, and whether it's EMS or it's police, what happens is they kind of give us, the briefing of what's going on, introduce us to the person, and then they go on their way. We're like, okay, we're good. You can take off, and they can go back to doing the type of things that they signed up for, right? I mean, we signed up to be therapists. They signed up to be police officers or EMTs. So it lets them go back to what they want to do and also what the community needs them to be.
Right. What they're valuable at, what they're trained to do, what they're valuable to do. I also imagine that you are seeing some of the same clients again and again. Is that the case?
In a few cases, I would say. A lot of them are one-off situations, but I think we operate in a little bit different way in some situations than a normal crisis team does. So a lot of times crisis teams they're designed to come out and de-escalate and resolve the situation. When we look at it, we also look at like, how do we prevent this? And so a lot of what we do is providing resources or connecting them with, where can they get therapy? We're following up in 24 hours to make sure that they got connected to those resources. And so there's additional pieces there where we look at it like, if we can deal with whatever's leading up to this being a breaking point for you, we can ideally prevent this from being a breaking point in the future. But yeah, there are some individuals that, yeah, there's a lot of calls from. We have some individuals that, between our crisis line and us going out in mobile crisis, we've probably seen 40 times. Most of those are phone calls, thankfully. We give them our crisis line card because we have our own internal crisis line. And so I think that's another piece of it. Those individuals tend to reach out to the crisis line when they're building up instead of waiting to a point that they're actually at that, last ditch, don't know what to do, and law enforcement or somebody else gets involved.
Are you able to help some people just over the phone?
We actually help probably more people over the phone than we do in person. And that's just a situation where, a lot of times it's, and I don't want to make it sound like it's not a crisis for that individual, but crisis a lot of times is not here, right? We look at it like it's this big thing happened and it's the end of the world, and every one of those crises is, I want to die. I've had a father who had his kids for the weekend, or correct that. He was getting his kids that night, or the next morning. I don't remember exactly, but he didn't have any food. He knew that his ex-wife was going to make sure he was never going to see his kids again. She'd already been trying to battle him. And it was a situation like, what's the point in living if I'm not going to see my kids? And it literally came down to connecting him with food resources.
Yeah.
And so by being able to do that, and we did that one was in person, but there's also situations where people call and that's where they're at. Our drop-in center is another one where people know it's open 24 hours a day. So they can walk in and say, look, I don't know how to get Medicaid, right? Or I lost my job and I don't know how to apply for unemployment. And that's some of the things that the people in the drop-in center help with. So we can stop that crisis before it gets really high. And so, a lot of our calls to the crisis line are not mobile dispatches. They're talk to somebody for 30 minutes to 2 or 3 hours, and then kind of talk through what's going on. And so we can resolve a lot of it just by intercepting it sooner.
Well, Justin, bless you. Bless your work. Tell your team hello for us. And thank you so much for talking to me today.
Thank you. Appreciate it.